El Consejo de Desarrollo de Tijuana, CDT, es un organismo integrado por empresarios y ciudadanos comprometidos con pensar y construir el futuro de la ciudad. Su trabajo consiste en impulsar proyectos estratégicos que ayuden a que Tijuana crezca de manera ordenada, innovadora y con mejores oportunidades para todos. Consúltalos en cdt.org.mx.
If you could lose 30 pounds with a weekly injection, would you still choose surgery?
And if that surgery costs half as much just across the border, is that smart healthcare or a sign of the system is broken?
Over the last few years, medications known as GLP-1s, drugs like Ozempic and Wegovy, have completely changed the conversation around weight loss.
But despite that shift, Tijuana remains one of the world's busiest destinations for bariatric surgery.
So what's really happening?
Welcome to Border Masters Podcast, the podcast exploring the people and the ideas shaping life along the U.S.-Mexico border. How are you, Gustavo?
I'm doing great, Monique. Great to see you. Well, I'll tell you a little about today's guest. He is challenging one of the biggest assumptions in healthcare, that the best medical care must always come from the most expensive systems and remain within national borders. We're joined by Dr. Ariel Ortiz, a bariatric surgeon based in Tijuana, Mexico, whose work has attracted thousands of patients from the United States and around the world.
And at this time when obesity rates continue to rise and access to treatment remains uneven, Dr. Ortiz has become part of a much larger cross-border healthcare movement where medicine, economics, psychology, and patient transformation intersect. Dr. Ortiz, welcome to Border Masters.
Oh, thank you so much. It's a pleasure being here.
Thank you, Doctor. Just a few years ago, bariatric surgery was widely seen as the most effective long-term treatment for obesity. Then came a new generation of medications, GLP-1 drugs like Ozempic and Wegovy, that seemed to change the weight loss industry almost overnight. But despite that shift, Tijuana remains one of the world's busiest destinations for bariatric surgery. Why is that?
I always start by saying that it's geography. We're smack right in the middle of the two fattest countries. I mean, actually, Mexico is considered the country with most obesity and overweight population. And then secondly, the United States. So from a geographical standpoint, Tijuana is just across the border from San Diego, as most people know. Some people poorly understand that it's really sister cities that almost interact on a daily basis. I was just being asked before the podcast, so you cross the border every day? Yeah, I live in the United States. I work in Mexico, so I live in one country, work in another, and I'm back home for dinner in country number one, right? So geographics plays a big part of it. The other is the actual population that is our target or our goal patient, right? So U.S. and Mexico. And lastly, I would say economics. It so happens that Tijuana and the region is considered amazingly popular for the traveling patient. They call it health tourism. I prefer to call it cross-border healthcare. And what happens is that it's been a phenomenon that has happened for over half a century. Back in the days, Tijuana was not very, let's say, reputable because people would come down for miraculous treatments for cancer or abortions back in the 1940s, 1950s. And, but it's evolved into the epicenter of health tourism, of cross-border healthcare globally, considered top 3, let's say. And not just in bariatric surgery, in plastic surgery, in regenerative medicine, ophthalmology. You, Gustavo, know a lot of our friends that are world-renowned in that fact. So I think that more or less covers why we're so popular.
And we actually had Dr. Tayet also in one of our of our previous Border Master podcast. And like you said, like you cross the border to work, but also live here. So that's like the main idea of Border Masters. However, I wonder, has the rise of GLP-1 medications changed the type of patients seeking bariatric surgery? And do you now see medications and surgery as competing options or as part of the same treatment journey?
That's a great question. I mean, and it's amazing that you would phrase it that way, because it really is a dramatic change in the patient that we're seeing. And though medications correctly used have a desired effect, we have to start with the premise that GLPs are supposed to be for life, right? Number two, they're studied enough to be approved, but the long-term effects have not been seen. Number three, they become more and more effective as the combination of medications, GLP plus additional medications, in the newer generations of medications become more effective, almost competing with weight loss surgery. But what happens with those patients that are taking these medications? And we've seen probably a reduction of patient load or patient traffic between 50 to 70%.
Oh, wow.
So being a epicenter or a city that was performing over 1,000 surgeries a week, they're down to maybe a couple hundred at best. And what happens now is that the type of patient we see is a patient that either is extremely obese and has zero effect on the medication, or those that couldn't tolerate the medication, or those that don't want to be on medications for life or can't afford it, because literally you're going to spend the same amount of money buying medications here for 6 months than you would for a surgery that's going to work for the rest of your life. But lastly, what I'm seeing is patients that have been on medication for a year or two, and they've lost a certain amount of weight. The problem is that weight depends on lean mass. So what's happening is that maybe they lost 50 pounds, but 25 pounds of that or 20 pounds of that was from lean mass, muscle, bone density, hair, nails, stuff that you might need. And what happens is that when they stop the medications, the weight comes back, but the muscle doesn't. So lean mass is literally your fat burning engine. So when these patients come back, they come back very sick with a really bad weight loss or weight regain. And the final body fat analysis is around 50, sometimes 60% of the patient is now fat. So, wow. And it's been published, but I don't know. We all want to be hopeful that there's one single medication that's going to get it right and going to resolve the problem. The problem is much bigger.
My goodness. Very, very interesting what you just said. How do you respond to the criticism that bariatric surgery is a shortcut that avoids discipline and long-term lifestyle changes?
It is a shortcut. A shortcut from disease, a shortcut from suffering, a shortcut from metabolic. Here's an interesting fact. 80% of people that are overweight and obese have metabolic disease. And that's the one that's really we want to concentrate on. And 30% of patients that are not overweight also have metabolic disease. So then the question would be, what is a metabolic disease? Metabolic disease is basically when your insulin goes haywire, thus your blood sugar reacts, your triglycerides and your cholesterol, with the impact it has over, which is called the lipid panel, right? It has especially over your heart, excess weight, and basically high blood pressure. These are the things that are important. Why are they important? Because they're going to kill 70% of the population. 7 out of 10 people are going to die from metabolic disease. 7 out of 10 people we know. 32% are going to die from cardiac issues. In other words, a heart attack. 30% from cancer. There's 13 cancers that are intimately related with metabolic disease. And then you add to that the insulin dependent problems like diabetes, complications from that, renal, dementia, Alzheimer's. And there's a lot of diseases that exist that are part of the metabolic disease. I'll give you an example. We were just talking about this. Infertility. PCOS.
What's PCOS?
It's polycystic ovarian syndrome,
okay.
which basically causes infertility. But more importantly, it's treated with hormones when it's literally just basically a type of diabetes. It's insulin resistance. So the bigger problem is not being overweight. It's the metabolic state. And like I said, you don't have to be overweight to have it. 3 out of 10 people that are normal sized or normal weight have the same syndrome.
Yeah. We're going to cry now, everyone.
Yeah, I know it sounds dire, right?
It sounds very dire, but okay, let's get into it.
But I want to ask you, so you talked about all of the consequences about GLP-1s, despite of all the good things that we have heard. However, with all of the success of GLP-1 medication like Ozempic, how do you determine when surgery is still medically and ethically appropriate choice?
Well, let's say we can start from a scientific standpoint, and then we can go to the actual more logic selection. From a scientific standpoint, GLPs were not indicated for obesity. They were indicated for metabolic disease, right? So to control, and they control it really well. And we're still seeing that as long as you use them correctly, you're going to do pretty well. It's going to change that dramatic risk that you have a heart attack, stroke, Alzheimer's, dementia, that whole thing. But when you don't use it correctly, what's going to happen is that you are going to create muscle wasting, and then you end up not in the best condition, right? More importantly, when you select a GLP, you have to understand that you're going to take it for life. And life gives you ups and downs, and many people lose their coverage. Many people have economic situations, the restriction of the actual medications that have been running out in the U.S. and in Mexico, et cetera. So there's no guarantees that you can be on that medication for life. On the other hand, if you do it right and you foresee all these things, you can be on those medications and actually lose enough weight that the disease reverts. Not just the excess weight, but the actual metabolic disease.
Wow.
When would you indicate surgery? Surgery is the first line of defense. And people say, no, how can you do that? It's like, well, we've been doing surgery I've literally done 30,000 surgeries in the past 30 years, mostly on U.S., Canadian patients. The surgery we perform is around 20 minutes long.
Oh, wow.
That's very quick.
So from start to finish, our patients are walking around a couple of hours after the surgery. Patients are discharged that same day or the morning after. And their excess weight loss is around 70%. In other words, 70% of what was the complete excess weight. Many patients get up to 90% and some to 100%. And it just depends on how they work with a procedure. And I think the most important thing to say is that it's durable. It's long lasting. I see patients that are 10 years out that have changed their life and they're not on a medication. So when you see the benefits of something that's permanent, one of our ads says, why rent your weight loss when you can own it? Right. So, and lastly, from just a plain old common sense perspective, the bills are going to add up. And if you're expensing it out of pocket, It's going to cost you more to be on a medication in 1 year than it is to get
the surgery,
a procedure, especially in Mexico, where it's a third of the price.
Let me get into a little bit, the people that actually go through this, because we're talking about it as if, I'm certainly not familiar with it. It's not happened to me, but people often think about weight loss as purely physical, or at least we tend to think of it that way. But many patients actually describe the surgery as emotionally life-changing as well. Are there perhaps psychological shifts, or what kind of psychological shifts do patients need to prepare for before and after the surgery?
For us, it's been very simple, because there's kind of like a waiting list. And during that waiting list, you have to do a lot of questionnaires, some interviews, and everything we do is telemedicine. So basically, patients fill out a survey, they send it over, and they see some videos, etc. So there's a lag phase between the time they schedule to the time they get the procedure. Not a lot, 3 weeks, a month. But it would seem that phase kind of weeds out those that aren't ready for a surgical procedure. Ultimately, the surgery is going to do its own thing, and it does it really well.
Okay.
Even if you're trying to sabotage it, it's going to be difficult. Having said that, it's very rare that you're going to find a lot of, from an ethnical standpoint, Mexicans are my worst patients. Americans are pretty good. I always use the example of Disneyland, right? So you're in Disneyland, and you're going to get on a ride, and that's all the Americans are on a single file. And the dude that's trying to get cut in all the way to the front is a Mexican. So it kind of happens from a behavioral standpoint as well. But ultimately, it's a very resilient procedure. It's time proven. And one of the things that I've seen over the years is that you might have more psychological issues or more complex issues, but it's kind of resistant. The surgery does its thing, and the final impact of losing weight is always beneficial to the psychological profile. Back in the day, we used to do these psychological profiles, and well, that X patient is not going to be a really good patient, but Y patient is amazing. And we would always get it backwards. So we don't really qualify a patient psychologically. We just prep them for something that is going to change their lives. And it literally does, like you mentioned.
Wow. And beyond cost, what do you think is really driving so many international patients to seek care in Tijuana?
We're really well known. I mean, I've been on Dateline, Nightline, MSNBC, Stuart Barney, Good Morning America,
Oprah Winfrey.
I've been on Oprah Winfrey.
Wow.
And why? Because it happens that Mexico usually does certain procedures and techniques and uses medical devices between 5 and 10 years before the U.S. does, simply because of the FDA, et cetera, et cetera. So we've been in the right time, right place. We started gastric banding many years before the U.S. So I actually ended up training U.S. surgeons all around the U.S. on the technique. We performed the first adolescent surgeries, 13, 14 years old. That's how I ended up on Oprah Winfrey, 13-year-old having weight loss surgery. We published a series of almost 100 adolescents, and then it became the treatment of choice in the U.S. So all these things you mentioned, Dr. Chayet was here. He's also somebody that publishes, that's very well known in the literature, in the global literature. And literally we have either participated in patents and trademarks in key studies, pilot studies in new medical devices like gastric balloon. The world's first swallowable gastric balloon was designed at our hospital. And the first 30 patients happened there. And then it became FDA approved and it got its IPO. So a lot of things happen in Tijuana, and it's a combination of popularity. I want to say expertise. In other words, there's a lot of high value talent. And lastly, patient flow. And of course, the price difference does increase the traffic of patients.
It's very interesting that you talk about these innovations that you were just mentioning here. And it's the fact that Tijuana really is becoming a medical technology capital or location.
Yep.
More than just, I'm going to have my surgery in Tijuana. It's not, that's just the tip of the iceberg. It is a huge, huge development. And you've led the way, at least from the bariatric side and probably other aspects of medicine. And I think that's very important to mention. Tell us a little bit about the insurance and the financial reality behind all of this. How does cross-border bariatric care work with American patients when many insurance plans in the U.S. still don't fully cover obesity treatment?
I would say it's 100% cash pay. That's one of the things that drives a patient to look for different options. If you can't get the treatment covered by your own insurance plan, you want to expense it out of pocket, and you end up looking at U.S. pricing, and it's literally tens of thousands of dollars, 20, average 30,000, depending on where you're at. So looking south, I mean, people look all across the world. Turkey is a destination, sure. Central America. But if you're hours away from any point in the U.S. to San Diego, you cross the border. And that's how we built our business model. 98.8% of our patients come from the U.S. and Canada. And our business model is really simple. Patients look at our website, talk to our patient care coordinators, look at the 500 plus testimonials, or 1,000. I don't know how many I've gotten. And then they decide to go ahead and get a procedure performed. We've got so much online material that by the time they visit us, they know who we are. And it's a one-click experience. It's basically, they say, yes, we're going to pick him up at the airport, drive him across, send him up at the hotel, take him to the hospital. The hospital is basically one of the most accredited hospitals anywhere. It's Joint Commission accredited, Global Healthcare accredited, ISO accredited, et cetera, et cetera. And like you said, we not only perform surgery, it's the physical aspect of the place is amazing. We leverage technology. We're partners in technology because we want to end up with the best result possible. And a 30-year track record helps. And ultimately, we can do 10, 12 patients in a day and get them back to the hotel. And the next 10 to 12 are coming in the next day, et cetera. And when you compare that to what happens in the U.S., we've literally become high volume experts with a very controlled outcome and pricing structure. So we would be the answer for those insurance companies trying to provide a product, a weight loss procedure. But it's difficult to get a U.S. entity to work with a Mexican hospital. We're still working on that. We were doing a very interesting partnership with UCSD, but then all the political stuff happened and they've got other fish to fry right now.
Vamos a una pequeña pausa. Estás escuchando Border Masters. Regresamos en un momento.
Content creators ready to take your podcast from something you just thinking about doing to making it a production reality?
Olas Media is San Diego's premier podcast network with pro producers and top facilities.
Visit olasmedia.com and get started today.
Let us amplify your brand.
La Asociación de la Industria Maquiladora de Baja California es el organismo empresarial que representa la industria manufacturera de exportación, IMEX, ubicada en la zona costa del estado, articulando servicios especializados, vinculación institucional y una comunidad activa de empresas líderes. Los puedes ubicar en www.indexzonacostabc.org.mx.
Border Masters está de regreso. Volvamos con Gustavo y Monique.
Wow. This is just mind blowing, and I have so many questions for you. So, but I also would like to know like some of the consequences of this surgery, because I do know, and I know people that have gone through the procedure. Like you said, their life changed, they are changed, everything is wonderful. But I also have seen some of the consequences. Can you talk about of like what can anything, because we were talking about GLP and one, and you're thinking like, well, I will just inject myself and that's it. Here you go under anesthesia. Like, what are the consequences for life that someone going through this will face?
I believe that everything needs to be well thought out, especially when it has to do with health. If you're going to take a GLP, you don't want to do it yourself. You want to go to a physician that knows what they're doing and use it for the right reasons. Same thing happens with weight loss surgery. I mean, you're going to do your research. You're going to meet a lot of people that have had it and it changed their lives. Is it going to change your life for the better? Most probably it will, but there's some factors you want to take in account. If you're listening to this podcast, you're going to say, I'm going to go to Mexico. Yeah, it's good to go to Mexico. Well, I'm going to do my research. What are you going to do? You're going to hop online and look for a good place. Well, everybody's going to talk really good about themselves. And nobody's going to say, oh, no, we're not the best. We're really cheap. Right? And a lot of people end up being swayed by pricing.
Mhm.
So they start being, and you pay, you get what you pay for. And in nowhere is it more evident than in surgery. So just very quick pointers, you want to go to a reputable center with a track record, with accreditations. You're going to have a difficult time finding them because they don't exist except in very few centers in Mexico. And why accreditations? Because it's a third party, more than nonprofit organization. They're organizations that have no conflict of interest. And what they do is they look at every single factor of quality and safety in the hospital, and then they give you a seal. If you don't pass one single factor, you don't get the seal. And this is what many American hospitals have. And it's basically required by insurance companies that you're accredited in order for them to get paid. Same thing with Mexico. There are these organizations. Now, once you've selected the site, you have to understand that surgery has its own set of factors, undesirable effects, and even complications. No procedure is complication-free.
Mhm.
Well, that's why you want to go to the best possible site that has a proven track record, numerous procedures, et cetera, et cetera. And lastly, you want to know what procedure you're selecting it and why. There's procedures that are less aggressive and procedures that are more aggressive. The more aggressive ones, you're going to lose more weight, but you're also going to have more undesirable effects, more protein loss, hair loss, nails, etc. The skin quality. The less aggressive ones, you lose a little bit less weight. So you have to do a little bit more on your own. But ultimately, after 30 years of bariatric surgery, in general, the complication rate is extremely low. The success rate is extremely high, much higher than back surgery, much higher than cardiac surgery. So doing these things, selecting the right center, studying the type of procedure you're going to get, and preparing yourself physically and mentally for a procedure should basically take you to the success rate that most everybody enjoys.
I get it, doctor, when you say that prices sway U.S. and Canadian consumers or patients. But I think that for many Americans and Canadians, crossing the border for healthcare still feels a bit risky or unfamiliar. What usually helps these patients move past that hesitation and trust a doctor in Mexico? Is it just price? What is it?
When I analyze my patient load, 30% of my patients come from online experience, 30% from referrals from other physicians and specialists, and 30% from basically word of mouth. So when you analyze the different sources of these patients, they're either going to trust somebody that came over, and that gives them a little peace of mind, Many are still going to go do a deep search or at least a quick search online, and they're going to look at your website, your social media. And I believe that one of the most important factors in this equation is how you treat the patient. I have so many patients that tell me that they selected an X or Y center and they said, you know what, something didn't feel right. Because they were being bullied to pay their deposit or just pick and send their check, etc. And this is a lifelong commitment to surgery, and we respect that. So very importantly, whoever answers the phone has to treat you like a person, has to treat you like an individual, somebody who has a specific problem to be treated, somebody that has a mom, right? And not as just another client and another client. And even though we have this amazing volume of patients looking for us for surgery, you got to treat each one specifically, individually, as a person, humanely. So that's one of the parts that I think has the biggest impact. And then patients decide, it's like, that's where I'm going. Sometimes I tell my patient care coordinators, because we don't use AI too much yet. We use them to educate patients, but we also always want somebody who's alive in person on the other end of the phone. I tell them if they have issues, just connect them with me. I talk to patients 10 minutes and they're like, where do I sign?
You calm them down.
Exactly.
And we talked a lot about Tijuana. And of course, again, border masters, that's what we talk about, the cross-border healthcare that you were talking about. Tijuana being this place of innovation, of health tourism, that you don't like that term, but like being like this spot where a lot of people internationally come for care. Within Mexico, is there another city that is in that position that other international patients look into, like Mexico as a country in general, or is it Tijuana where we are like top notch?
I would say Tijuana is number one without a doubt.
Wow.
You've got Algodones right here in the border. Algodones is very famous for implants, implantology.
Oh, wow. I didn't know
yes.
that.
Yeah. Dental implants, by the way, not the other implants.
Wow.
And the border towns are more popular, let's say, but there's no other border town like Tijuana because it has San Diego as their border.
Yes.
The only other city that really has a high volume of traveling patients is Cancun. But everybody in every single state in the country is looking at Tijuana to replicate the model. Why? Because you've got a lot of expats in many different areas.
Right.
You have different sources of patients. Those that travel by car, and that's how you get to Tijuana, or those who travel by plane, like Puerto Vallarta, Cancun, and all these cities have a big offering as well. They're trying to compete, or they're basically replicating the model of Tijuana, and each one has their own little niche where they're very successful. Plastic surgery, Cancun, regenerative medicine, Puerto Vallarta, et cetera. And then they become destinations in their own vein.
So you've said you've done over 30,000 procedures. When you started your practice, did you ever imagine that Tijuana would become part of this healthcare solution for so many people?
No, actually, I didn't. That's a really good question. We were just talking about, I was born and raised in Tijuana back then when nobody was from Tijuana, right?
Right.
Tijuana is a pretty young town. And like I said, it had its beginnings with a little bit less than ideal reputation, kind of shady things going on, certain medical services, but then became a real high-end destination for medical care. And we've mentioned bariatric surgery and plastic surgery, but orthopedic surgery is extremely popular, and especially from different countries that have different issues. we get a lot of Canadian patients seeking orthopedic surgery. So we are literally at the service of those areas of opportunity that exist north to us. So the US and Canada, they have certain issues and weaknesses with their health system. That's where we come in. And what has happened very recently is more and more you see the Mexican medical community kind of organizing themselves and understanding that the biggest part in order for us to be able to create a destination of cross-border healthcare is to elevate their standards, which means that more and more centers, hospitals, clinics, offices, dental offices are looking to become accredited. And that is goal number one. If you have a quality accreditation, you are up to the standards that are required by several U.S. organizations like the CDC, the Centers for Disease Control, the American Society of Bariatric and Metabolic Surgery, the American College of Surgeons, the American Medical Associations. They all have position statements where they recognize the right of a patient to travel abroad for care. But the only thing they all agree in is that it has to be a center accredited by, preferably by Joint Commission. And that's what we're trying to consciously have happen in Tijuana. We're an organized destination. New things are happening, like the medical district in the Zona Rio where we're at. We're the first building crossing into Mexico, but this whole area is a medical district, and we know for a fact that signage is going to be going to be placed in English, delineating where certain areas, where certain services are, hospitals, etc., and becoming an organized destination at the service of the international patient.
I imagine it's difficult, it's challenging to get an accreditation. You've done it with your clinic in several different cases, but when you talk about a city or a district, is that right? Am I being correct in saying that it's not just a clinic getting accreditation, but it's an actual city or a district within a city getting some sort of an accreditation?
So it's two things. And yes, you're right. Getting an accreditation is pretty challenging. Now, the more you respect the whole process, the easier it becomes to say, all right, I'm going to have my organization, my hospital, or my clinic, or my doctor's office get accredited. It's expensive. It requires infrastructure, requires certain talent, certain technology, and most importantly, processes. And it literally changes the way you perform or you execute health services. I'll give you the example, which is the analogy, which is air travel. Air travel is accredited, and they have their safety profile, and that's why it's the safest way of transportation, because they look at every single possible scenario and avoid any error. Same thing should be in medicine, and that's why the accreditation is so important. Now, when you talk about a destination, there's other things involved like security, safety, how you facilitate the process, especially if you're in a border town. I mean, we're no strangers to the facilitated crossing back and forth from the U.S. to Mexico, or the border, cross border in the airport, things that are very unique for any two cities, more importantly, two nations. And that's something that we're trying to implement specifically for traveling patients, a facilitated process to get in and out. And when they're in, how to move around in the destination.
So are you I love this. And it's the first time I hear about the medical district, but I think that will be amazing for a city like Tijuana. And I think it's like we're going towards that direction. However, like, do you see the cluster of people in medicine, hospitals like the one you own, like everything? Are you coming together to push with the governments and everything to make this possible? Where I see a little of discrepancies that sometimes even people in the same industry don't talk to each other, yeah. Don't support each other. So instead of going towards like a goal like this, which would be amazing, the medical district in Tijuana, I feel that there's some discoordination. What would you say about that?
It's no secret that we're in a kind of a small dip from economic standpoint and patient load, let's call it, visiting Tijuana and anywhere for that matter. So I think many phenomenons have happened during the years, like elections and crisis and war, and it just all accumulates. But these are moments where people regroup and thrive. As a destination, we are not an organized destination, but we're recognized as the leaders in all of Mexico, which basically then tells us that we should get organized. Mm-hmm. Right now, we compete for a $8 billion market, which is doctor to consumer, right? Or business to consumer. That's an $8 billion market in 2020, which is the health tourism market. But if you organize the destination as a cross-border health service provider, and you all get accredited, now you start competing for the $500+ billion health services that are required in the U.S. And we're their best option. We have the timeliness of care, the quality of care, the variability of care, the availability of care, and the cost of care. We have all those things better than the U.S. can provide. What do we need? We need to organize the destination. So what has happened recently is the government is actively working on projects like the medical district project and at least putting the signage up. We already have some plans that we're looking into seeing if we can acquire a small transit system that's going back and forth all around that area and just bringing patients in, sending them around, and then getting them back. They even created, and which is up and running, an app, a geo localization app for visiting patients to know where the different hospitals and centers are, clinics, et cetera. It even has a panic button if they feel the situation is not secure, et cetera. So it's difficult, but it's not impossible to all point towards the same direction, which is creating a safe and very well-organized destination for cross-border healthcare.
So, Dr. Ortiz, we're headed toward the end of the episode, and I wanted to ask you, after all these years treating patients on both sides of the border, what continues to drive you, and what impact do you hope your work leaves behind?
You know what? It's like I mentioned before, it really, it kind of could probably get blurry after 30,000 patients, but every single patient brings a very unique story. And even though I manage a hospital and we have 120 physicians, we were just talking about certain types of specialties we have where we have international surgeons like the endometriosis and the endoglobal group that has surgeons from all over the world. And they bring in patients from all over the world. It's always great to listen to the particular and individual story each patient has. And because my philosophy is patient is always my main goal, is well-being, his or her well-being. We concentrate on that. Everything else is it's just basically a second. Our priority is that the patient does well, they recover, and they go back home, and they're happy and satisfied. One thing that I want to say that we do have, which competes with the U.S. and anywhere else, is that we're not only specialists in medical care, we're specialists in hospitality.
Mm-hmm.
Yeah,
That
very
marks
important.
the difference between any other destination globally. So we not only want to take care of the patient and resolve his issue, we want them to have a great experience. And that's something you don't see in healthcare.
I love that. And I love also that, like, at the end, you're a doctor, right? And so I love that even with everything that we see and all the media and all of like, just come and do your surgery here. At the end, the most important thing is the patient, as you said. So I love that. So Dr. Ariel Ortiz, after everything we've discussed today, when you hear the phrase border masters, what does it mean to you?
We are in such a privileged place. And again, it's so easy to impress because when you hear about the border, people are swayed, people have a preconceived notion, but then you actually know what's going on. And it's like, why didn't I ever hear that? Well, partially it's because, well, we kind of keep to ourselves. Maybe it's the best kept secret. I'll give you an example. I went to El Valle de Guadalupe, our wine region. We sit down. It was around COVID. We basically had started coming back. We were at Bruma, a very nice restaurant called Fauna, and it was all Mexicans. And there were two Americans sitting in this communal benches. We were right there, and we were eating it. And the guy asked me, he's like, "Are you guys local?" "Yes." Like, "Do you know Americans?" "Oh yeah, a lot of Americans." "Please don't tell them about the place." It's like, we want to keep it to ourselves. We literally are the best kept secret. I always say, come to the hospital, come to Tijuana, come. When people cross the border, usually they're impressed, and not just by the quality of the city, by the buildings, by how evolved the whole city is. They're impressed by the talent that they're surrounded with. Not just the medical talent, the culinary talents, the wine country, the small breweries, etc. There's so many things that are happening in our town. And being somebody from Tijuana, I love Tijuana, and I don't think I know we are masters of that border.
So you always ask this question too. Do you consider yourself a border master?
Well, let's say I'm trying to become one. There's a lot of competition, but yes, I think at the end of the day, you want to always have the destination in mind when you're delivering services. So yes, I am proud of where I'm from, and I love to show it off.
I love it, Dr. Ortiz. I love it. Thank you so much for joining us today. This has been a fascinating conversation about obesity, healthcare access, and the changing future of medicine across the border.
And thank you to all of our listeners for joining us on Border Masters Podcast. You can find us on Spotify, Apple Podcasts, and Olas Media. If you have comments or suggestions, please reach out to us at info@bordermasterspodcast.com. Thank you so much, Dr. Ortiz.
Our pleasure, man. Thank you. I am Dr. Ariel Ortiz Lagardere, and this is Border Masters.
This episode of Border Masters fue creado por un Dream Team. JC Polk, nuestro production consultant that supports us con su experiencia y creatividad. Lina Álvarez, nuestra executive producer, siempre al mando. Ulises Bretón, nuestro creative director, bringing the vision to life. Alan González, el audio engineer, que nos hace sonar increíble. Y un agradecimiento especial a Chad Peace, founder y presidente, por ser la inspiración detrás de todo esto. Producido entre la sunny San Diego, California y la vibrant Forever en Tijuana, Baja California, Olas Media es parte de IBC Media Group. ¿Quieres más? Check out olasmedia.com para más episodios y el blog del show. Gracias por escucharnos. De parte de Gustavo y Monique, nos vemos la próxima vez.
Olas Media.
DEITAC reúne a líderes y tomadores de decisión que están transformando la economía de la región. Con experiencia de más de 36 años promoviendo la inversión extranjera para Tijuana, DEITAC conecta empresas, instituciones y profesionales para generar alianzas estratégicas reales. Consúltalos en tijuanaedc.org.